practice and research literacy. My name is Deb Hill, and I am the project manager for our project to enhance research literacy here at the Academic Consortium for Complementary and Alternative Healthcare, otherwise known as ACAC. While ACAC is the host organization for this webinar series, this is also produced in conjunction with the Alliance for Massage Therapy Education, the Commission on Massage Therapy Accreditation, the Massage Therapy Foundation, as well as the National Certification Board for Therapeutic Massage and Bodywork. So welcome everyone today. As a little housekeeping, I will mention that everyone is in listen-only mode at this point. Our session is being recorded for future downloading from our website. And also, if you have any questions, please go ahead and type them into the control panel on the GoToWebinar software, and we'll get to as many of those as possible at the end of our presentation today. So for those of you joining us for the first time, and as a refresher, I just wanted to give a little overview of what the Academic Consortium for Complementary and Alternative Healthcare is. We are a broad, multidisciplinary organization that fosters interprofessional, collaborative healthcare. And really, we consist of 5 core professions. And 2 of those are represented on our webinar today, and that is acupuncture and oriental medicine, as well as massage therapy. So welcome, everyone. Altogether, through our member organizations, we can be linked to about 375,000 licensed healthcare providers, as well as about 180 accredited academic institutions and programs. And we're affiliated with traditional and world medicine fields, as well as holistic and integrative medicine organizations. So as an organization, we identified a set of core competencies to help those of you who are working in collaborative healthcare environments. And one of the 6 of these core competencies is in evidence-informed practice, which brings us to our topic today. And these were addressed, or these were endorsed by all of our core professions. So it is a multidisciplinary effort. And as an interprofessional organization, it is fitting then to hear from at least 2 of our core professions as we address the topic of evidence-informed practice. So without further ado, I wanted to go ahead and introduce our speakers today. First, we have Dr. Belinda Anderson. Hi, Dr. Anderson.
Hi.
Nice to have you join us today. So Dr. Anderson is earned her PhD in molecular biology from the University of Sydney and her master's degree in acupuncture and Chinese herbal medicine from the New England School of Acupuncture. She has over 20 years of administrative clinical research and teaching experience. And she is currently the academic dean and research director at Pacific College of Oriental Medicine in New York, which is the largest college of Chinese medicine in the United States with campuses in New York, San Diego, and Chicago. She is also an assistant professor at Albert Einstein College of Medicine and maintains a private practice at New York University Fertility Center. In 2013, Dr. Anderson was also awarded an National Institutes of Health NCCAM K07 Career Development Award to develop evidence-based medicine curriculum for faculty training at the master's program at PCOM in New York. So welcome, Dr. Anderson.
Thank you.
Next we have, a little technical difficulty on my slide deck. We have Dr. Cameron. Good afternoon, Dr. Cameron.
Hi, how are you?
Great. Happy to have you join us today.
Thank you.
So Dr. Cameron is a professor in the Department of Research at National University of Health Sciences and adjunct faculty in the Epidemiology and Biostatistics Division at the School of Public Health at the University of Illinois in Chicago. She's taught numerous research-related courses and postgraduate seminars, including the Introduction to Research and Biostatistics, Epidemiology, Public Health, Practice-Based Research, Critical Appraisal of the Literature, and Writing Case Reports. She has also served as a principal investigator on research studies focused on massage therapy and chiropractic care for over 20 years. And she is also currently serving as the president of the Massage Therapy Foundation. So welcome.
Thank you.
Right, we're happy to have you both. So a little bit of our agenda of what we're looking to cover today. We're going to give you a broad overview of evidence-informed practice and define evidence-informed practice, and then give you an example in terms of patient or client care. How does this apply to the clinical case? And then we're going to walk you through a search process and hopefully help give you some search tips to help find research literature that is applicable to your clinical case at hand. So we're going to go ahead and start with a definition of evidence-informed practice. And this is one that was developed from one of our ACAC-affiliated schools, Northwestern Health Sciences University, and taking a look at the definition in terms of each of the words. So when we define evidence, we look at it as the least biased way of knowing. And then when we define informed, we look at evidence really as a tool that can guide a clinician to better decision making. And then looking at the definition of practice is really the art of clinical care. And it's the skilled judgment of a clinician to consider a variety of factors when determining a patient's course of care. Putting this into a little bit of a broader perspective, I really like this overview, looking at how evidence-informed practice ties in not just the research evidence, but also the patient presentation and your clinical experience coming around to something that can be referred to as clinical jazz. So I want to go ahead and hear from Dr. Cameron and Dr. Anderson in terms of how evidence-informed practice might be approached within your individual communities and how you might also define this. So Dr. Anderson, why don't we start with you today?
Okay, thank you. I think there are some unique challenges in Chinese medicine with respect to the concept of evidence-informed practice, or what was formerly known as evidence-based medicine, principally because Chinese medicine is a discipline that's thousands of years old, and so there's a very large amount of anecdotal evidence. And what we teach in the colleges largely comes from that experience as documented in the classical texts and also the more modern in translations and interpretations of the classics. So practitioners of Chinese medicine are more likely to use evidence that's been generated in this manner rather than using research evidence from clinical trials, because there's not many conditions of which there is clinical trial evidence. So the nice part about EIP, this concept, is that it's trying to really impress upon clinicians that it's all types of evidence, not just evidence from scientific studies. And I think that makes Chinese medicine practitioners much more open to the concept and more likely to view it as a process of critical thinking in terms of how we come about the best treatment approach for a patient. So it's all types of evidence, evidence from our teachers, respected clinicians, textbooks, evidence that we gather through treating a patient and seeing them from week to week and looking at the outcomes of our treatments, and also the scientific studies, if there is one, for the particular condition that a patient comes in with. So the clinical jazz aspects relates to how you put all of that together. And in Chinese medicine, there are many different ways of practicing the medicine, and so you as a unique individual can put all those pieces together and come up with your own synthesis and decisions about individual patient care.
Wonderful. Well, thank you for that great overview, especially from the acupuncture and oriental medicine community. Dr. Cameron, I welcome you to comment on the view of evidence-informed practice, specifically from the massage therapy community, but also as evidence-informed practice.
Oh, I appreciate that. I teach in the chiropractic community as well. I'm also a chiropractor as well as a massage therapist, and in both of them, I just want to repeat what Dr. Anderson just said. Two different facets. One being we don't have the highest level of evidence, being clinical trials, for everything that we do, and so it makes it a bit frustrating when people think they should be looking for clinical trials, but there's lots of different levels of evidence. And so in our fields of massage therapy and chiropractic, we're always looking at, well, how much evidence do we have? Do we just have at the level of case reports, or are there clinical trials, or even better, systematic reviews or meta-analyses? And the other thing that Dr. Anderson said that I just want to echo is, even if there is a clinical trial, the issue always comes up as to, well, that's not how I practice. So whether it be massage or acupuncture or chiropractic, there's so many different techniques out there and so many different ways of practicing that even if there is a clinical trial, it's not always exactly mirrored within clinical practice, which makes it hard for people to kind of cross over. And so the whole issue of evidence-informed practice, of looking at these three different facets, trying to understand, well, what does the literature say but also what do I as a clinician know to be true and to have experienced. And then the third thing, well, what does the patient or the client want? Perhaps we have a clinical trial and it's something that we do all the time, but the patient doesn't want it. Well, we have to come up with what's the next best thing. And so trying to incorporate these three things together truly is what evidence-informed practice is all about. So trying to incorporate what does the literature say, what do I know as a clinician, and what does my patient want. So those are the three facets that we always focus on.
Well, thank you. Thank you for that great description, and especially as this all ties in together with the clinical jazz. I'm going to go ahead right now and just put up a question and have you all take a moment to answer it. True or false, clinical experience as an important part of evidence-informed practice? So I see a number of you responding. Thank you. We're still getting responses. Wonderful. So 100% says true. So
oh, wow. Good job, people.
So hopefully, let's see if I can get my screen back there. Everybody's seeing it now, and we'll go ahead and share the results. So great. Okay, so moving onward. There are basically getting a little bit deeper into evidence-informed practice. There's 5 steps to evidence-informed practice overall, and this is presented in a number of different ways. This is one way of presenting this as the 5 A's, which is ask, acquire, appraise, apply, and assess. And unfortunately, we can't cover all 5 steps on one webinar series today, but we will look at the first 2, and that is to formulate a searchable clinical question focused on your patient, and also search the literature to locate resources best suited to that clinical case at hand. In our next webinar, which is the Journal Club, we're going to go ahead and use that format to help appraise the literature, to evaluate the resources for validity. And then the last 2 steps really come into your clinical practice, and this is the apply and the assess, to use that information in the care of your patient, and then to go back and go ahead and evaluate if that information made an impact on that clinical care. So Dr. Cameron or Dr. Anderson, would you care to comment any further on those 5 steps?
Well, this is what we use at National University of Health Sciences. I see that you have down at the bottom the EVP at NUHS. We have lots of resources on our website at NUHS about these 5 different steps and how to do that. But, you know, it really makes the most sense to the students when we try and show them, here is what we're trying to do. This is not just an exercise of let's read an article. It really is about trying to think about what patients or clients do I have, what types of questions do I have that I feel like I need answered, clinical questions about them, perhaps about patient care or incidence of a disease or whatnot, and then trying to pull the evidence in, apply the evidence, and then decide for yourself as a clinician, did it even work? Is this something you want to continue with? Is this applicable to all people that come to your practice or not? And so really trying to go through these different steps and not think of, oh, I have to read an article, but rather try and apply it and keep it within the clinical thought process.
Great. Well, thank you for that additional information, the way to really keep that the clinical application in your mind as we move forward. That's a perfect entree into our next slide, which is really, this is one way to formulate a searchable clinical question, and this is called the PICO approach. And this really helps to refine that search process. And it's fairly simple in terms of the mnemonic, and that is P is for your patient or your population, I is for your intervention, C is for your comparison, and O is for your outcome. Basically, what are you looking to accomplish in that clinical care of the patient? So did either of you have anything else to add on this? We're going to go ahead and put that, plug in a clinical case next, but anything else on the PICO approach from Dr. Anderson or Dr. Cameron?
I had one other thing to say about this. One time one of my students had said, "Why are you having us memorize this crazy word?" or something like that, where, thinking that this was something that perhaps I had come up with. And I tried to explain that this isn't just within our school, our professions, our community. This is something that is more widely thought of in healthcare. And so I believe this was developed more on the medical side of things that the complementary alternative medicine folks have taken on. When I first started learning about PICO questions, we didn't learn it as PICO questions. The way we thought about it was, what would be the best title of an article? If you could find the perfect article that you're looking for, what would the title of it be? And so really that's what this whole searchable question is trying to get at. What are the key words? What are the important aspects? What is it that you want to search on? And trying to, think in your mind about, well, who is the patient that I'm interested? What are their diseases that they have, or conditions, or type of patient, whether it's geriatric or pediatric? And, what type of intervention are you interested in reading about? And is there a comparison group you want the article to talk about or not? And what are the outcomes of interest? And so really, it's just a way to, it's an acronym, it's a way to think about the different types of searches to do, so that we don't just plug in the word massage and get overwhelmed with a whole slew of literature, but we can try and narrow our search down a bit so that we really get to the articles that we're most interested in.
Great. Thank you very much. And that's another great way to look at it, is really, how do you find the best title of the journal article? That's another way instead of this mnemonic. But so moving forward, we wanted to go ahead and give you a clinical case example today. And I apologize because there's probably no other easy way to do this except for to read it. But basically, imagine that Jane has come into your practice, and your practice being either acupuncture and oriental medicine or massage therapy or chiropractic care. But Jane's come to you with pain in her right knee, and she's a 48-year-old mother of 4, busy woman. She's been an avid runner most of her life until about 5 years ago, when what began as lingering pain after her long runs progressed into knee pain after any activity. She had been to see an orthopedic surgeon recently who had diagnosed her with osteoarthritis of the knee and suggested nonsteroidal anti-inflammatory drugs to help manage the pain or possible surgical intervention. She's been able to successfully manage that pain with the medication, but the medication is starting to bother her stomach, and she's really looking for another way to manage the pain, and a friend suggested that she visit you. And so you would be in practice, that's the you part of this, whether you're an acupuncturist or a massage therapist. So going back to our PICO approach, in one way to help search this, when we would define that, then we would look at our patient, our population, whereas it's a woman, and their population would be the osteoarthritis of the knee, those folks with osteoarthritis. Our intervention would be either massage therapy or acupuncture. We would compare this maybe to standard of care, to nonsteroidal anti-inflammatory drugs, or maybe even leave out the comparison altogether. And also looking at our outcomes, we're looking at what outcome we're looking for is reduction in pain or return to functionality. So these are some of the search terms that we could use. Coming down again to refining that clinical question, is massage therapy or acupuncture more effective than standard care at managing pain associated with osteoarthritis of the knee? So that would be, I guess, as Dr. Cameron put it, the perfect title, might be another way to put that. Acupuncture, studying acupuncture in terms of managing pain associated with osteoarthritis of the knee. So did either of you have anything else to comment before we move on to the search process?
Yeah, and just to re-emphasize that you don't always have to have a comparison. So sometimes you might have a more simple question, which is, is acupuncture effective for osteoarthritis of the knee? So just to, re-emphasize that, because sometimes that is what clinicians are interested in, rather than actually, it's usually patients that are more interested in comparing it to another therapeutic intervention. Should I use this or should I use that?
Great. So thank you for reminding us of that. And there's, and all of these can be used in various ways as well, but that might be and especially with our clinical case example here, is this going to work to help to control her pain with the osteoarthritis of the knee? So we're going to take you over right now into searching this, and we're going to go into the PubMed database. And for those of you who haven't been there, it's just simply, we can type into Google PubMed. And I'm going to start with Dr. Anderson in terms of how we go about and search that clinical question that we're just taking a look at. So Dr. Anderson, I'll let you walk me through this.
Sure. So we'd want to put in acupuncture. And you'll see there, as we put in acupuncture immediately, there's a big drop-down menu, and that can sometimes make it easier, that you can see that searches have been done previously as reflected by that drop-down menu. In this case, we would put in osteoarthritis, and you probably see it drops down there, yeah, and there's knee there, so the second one down would probably be a great place to start. And we can see that we pulled up 52 different articles, which is it's kind of a manageable number, but you'll see over on the left-hand side, it gives you some choices about how to filter out information that might make it more relevant to your interests. So one of the issues about scientific studies is that once they get old, they're often no longer as informative because more recent studies haven't been included. So we could say that we would take out 5 years, only in the last 5 years. That would be a place to start to ask the question, well, is there a really recent review? And we can see that, yes, there is. So that's great. And then the article types reviews are often more helpful because they will look at a number of different individual clinical trials. So now we're getting a very manageable number. We can see we've only got 16 articles that we need to look at. The other thing that could come up is we may find that some of them are not in English. The ones on the screen now appear to all be in English. If they were not, there would be brackets around the title of the article, but it appears that all of them are, so that means that if you only speak English, then all of these are accessible. The other thing we might be looking at is whether they're freely available. Many clinicians don't have access to journals that would require you to pay for individual articles. So we've now selected out for the ones that are freely available. The other thing that might be a good criteria is to look at the more recent ones. So we see at the top one, there's one for 2013. That's last year, so that's nice and recent. And if it was me, I would probably take a look at that one. I would click on that first one. And here you can read the abstract, which is that summary that's shown on the screen. And you can get an idea, this being a review, one of the things we're interested in is how many studies they looked at. So we can see there's 156 studies that met their inclusion and exclusion, well, met the inclusion criteria, but were not eliminated. And as we glance over there, we can see it's 9,709 patients, which is a very good, large number of individual patients that were assessed. And we can see a brief description of the types of interventions that were looked at in these individual trials. The other thing that can sometimes be helpful when you're doing a PubMed study is over on the right-hand side, you can see related citations. None of these are particularly relevant, but I always look at that as well. There's something that you may want to look at as another way of finding additional information. This one, generally speaking, looks pretty good. The other thing that it says down in the conclusions here, as a summary of the current available research, the network meta-analyses. So that indicates that in this overview, they included a meta-analyses, which indicates that they pulled all of the data from the individual trials and then did a statistical analysis on the pooled data. So that increases the quality of the review and makes the conclusions much stronger. So overall, based on these factors, I think this looks like a very good review. And so if it was me, I would probably then proceed in on the top right-hand corner to get the full text article. Here we see the full text article. And once you get to this stage, you can then download a PDF copy. And then if you prefer reading it in hard copy, you can print it out. The other thing that we can now see is who the researchers are and where the research work was undertaken.
Wonderful.
And we can see the journal was published by Elsevier, which is a very good publisher of a variety of different types of journals. These are all sort of issues that are reflective of the quality of the review.
So that looked like one great article that we've come across, and we can take a look then and read that more fully, right, and apply that, or choose to apply it or not to apply it to our clinical care.
Yeah, absolutely. And the other thing you would find in that article is the citations for all the individual trials. So if you're especially interested in a particular trial, you could go back and find the citation. The other thing that's nice about reviews is they usually always include a summary table of all the individual trials and some basic details about those clinical trials, like the number of subjects that were included, whether they included a placebo control or other types of controls, how they measured the outcomes, and what the actual outcomes were. So we're not seeing one here, but we probably would find a table like that in this review. Yes, maybe that figure 1, maybe. Maybe that one.
Table 1. I apologize about that. It didn't pull up for us. Right, when we fully print out the article.
Yeah, you would find that. But that table is often a really good way of quickly looking across all of the studies and getting an overview. Here we go. Yeah.
Yep. So all of those that were included. So that's a nice overview.
The other thing that these reviews do is they do a quality assessment of all the individual trials that were included, such that the poorer quality trials contribute less significantly to the overall conclusion. And if you look closely at these papers in the methods section, you would find out how they quality assessed the individual studies. So that's what also makes these reviews more meaningful in terms of drawing broad overarching conclusions.
Well, great. So during our search then, we've come up with one great article, and then there was a couple others in here too that would have been of interest that we might want to check out. Is that correct as well?
Yeah, so we see number 2, and you can see that it's published in the Cochrane Database Systematic Review. So the Cochrane database for these types of reviews is probably the highest quality source. So if you see a Cochrane review, you would be inclined to choose that over another review. And the reason why they're so high quality is that there are a lot of rules and regulations about how these reviews are undertaken that the authors must adhere to, otherwise it doesn't get published. And that includes things that we've discussed, which means you must include every single clinical trial that was ever undertaken on this particular topic, even those that aren't in English, so you have to organise for those to be translated. You have to describe exactly how you did the search, so which databases you used, which search terms you used, what your inclusion and exclusion criteria was, and a breakdown of the numbers in terms of the total number of citations you started off with, what you ended up with once you applied your inclusion and exclusion criteria. And you also must quality assess every single trial that was included in your review. One of the problems in acupuncture with Cochrane database systematic reviews is that they're often, the final conclusion is that it's inconclusive. So that can be a little frustrating if you're a clinician, because you really want an answer that's going to help you make a decision. So the thoroughness of these types of reviews for acupuncture often means that it is inconclusive. So in that case, you might want to look at individual trials, recently conducted individual trials, to get something that's a little more conclusive. But one of the advantages of the Cochrane is that you don't need to be very knowledgeable about research yourself, because all of the quality assessment has already been done for you.
Great. Well, it looks like we have a couple of good resources, at least to start with, and then, as you'd mentioned, looking into the different individual trials that were included in there, that there might be one that's a little bit more applicable to your patient case, and you could go ahead and search for that one as well.
Right.
Wonderful. So that would be one approach from if you wanted to look for acupuncture. Was there anything else that you wanted to include, Dr. Anderson, before we move over to massage
No,
therapy?
I'm just wondering if anybody in the audience might be wondering why a lot of these the Cochrane database systematic reviews are inconclusive for acupuncture. And really the short answer there is because of the issues around the placebo acupuncture control. And unfortunately, that would be a very involved conversation. But suffice to say that that is the primary reason why a lot of them are inconclusive. And to get at that more directly is that there really is no such thing as an inert acupuncture intervention. So even when you do placebo acupuncture, many of these trials, practically all of them, has shown that placebo acupuncture is therapeutically beneficial. So when you try and compare it to the real, in inverted commas, intervention, you don't see significant differences, because the patients that got the placebo treatment got benefit from that treatment. So that's caused a lot of these trials that have compared real acupuncture to placebo acupuncture to the conclusion being that they're equally as effective. So you can imagine that then in a review it would become inconclusive. But I think that's broadly accepted in the field now, such that placebo acupuncture is not as common anymore as a control, and usually what acupuncture is compared to is either no treatment at all, if that's ethically possible, depending on the condition, or conventional treatment, which could be something like physical therapy or pharmaceutical drug therapy or whatever would be appropriate for that condition. But these Cochrane database systematic reviews haven't yet included enough trials of that type, more what we would call the comparative effectiveness, comparing one legitimate therapeutic intervention to another. And so we're not yet seeing systematic reviews that include a lot of those clinical trials. I think once we do, we'll see a lot more conclusive data in these reviews about acupuncture. Great.
Well, thank you for fully hashing that out and explaining a little bit about the difference between the reviews and the Cochrane reviews. That's much appreciated. So we're going to clear out our search and head this over to Dr. Cameron, and we'll walk through how we would go about this for a massage therapist. Dr. Cameron?
Yeah, that sounds great. Could you please click on Clear All, which is underneath Advanced?
Oh, sorry. Yes.
Thanks. So I really like watching other people do searches, and I suggest that you all, when you first start working with PubMed, ask to watch other people do searches, because every time I see someone else do a search, I learn something new. And it's interesting to me that Dr. Anderson and I have very similar methods for doing this. So I'm going to walk through the way that I would normally search, which again is similar, but I think that it's important for everybody to see we're doing the same things, and let's repeat some of this. So could you please type in osteoarthritis and the knee osteoarthritis?
There we go.
First one down.
Oh, sorry.
Osteoarthritis knee. Either of those should give the same results, knee osteoarthritis or osteoarthritis knee, so that's great. One thing that I do want to say is we had the National Library of Medicine come out and speak to us at National University of Health Sciences, and they talked about how they structured PubMed and the search bar and all of that, and they said that they actually did hire Google programmers to help them make PubMed be more like Google, because that's what the general public is used to. And so PubMed didn't used to have drop-down boxes, and so now that they do, I mean, it feels very Google-like, and it's really helpful to have these drop-downs. So osteoarthritis knee or knee osteoarthritis, that brings up 21,000 articles, and we want to look at massage. So if you could just add the word massage. Back in the day, we used to have to use Boolean operators, which is like and, capital A-N-D, and all of that. But nowadays, we don't have to. Again, that's very much like Google, where you can just type in a big, long string of words and see how many articles you get from that. And so I like to just keep adding more and more limits. So when we get to massage knee osteoarthritis or osteoarthritis knee massage, we end up with 60 articles. Now notice there's no limits on this just yet, but one thing I do want to say is that with massage articles in PubMed, I've found that a lot of times it thinks I'm asking for cardiac massage. And so this is one of the times when I do search on massage, I usually will add not cardiac. Not as a Boolean operator telling it whatever word I'm following, I don't mean this type. So if you add not cardiac, now we have 58. So it looks like 2 of the articles might have had something to do with cardiac. We've excluded those. I don't think there were a lot of articles on osteoarthritis and heart massage, but you never know, I suppose. I would think that instead of osteoarthritis, rheumatoid arthritis does have cardiac issues at times, and perhaps rheumatoid arthritis rheumatoid arthritis massage, not cardiac, might exclude a whole bunch more. But anyway, so we have 58 articles. The first thing that I typically will do is click on 5 years of publication date. So again, that means please limit my search to just within the past 5 years. That brings it down to 29 articles. So this is getting more manageable. The next thing I'll usually do is I'll take a look at, well, are there any review articles? So if you could please click on review. These limits on the left-hand side are so helpful because they really help us, not have to type in review article. We just click on these different buttons over here, and we can limit our search. So now we have review articles that are supposed to be about osteoarthritis knee massage, and we have 5. But if we look at these, we see complementary therapies, complementary and alternative medicine, exercise prescription, withdrawn. This is a Cochrane systematic review. When the Cochrane folks, there's review groups, and when they submit a protocol for doing a review, they can change their mind at some point. But it's already been out there that they're going to do a review. So in order for them to not do it, they actually have to withdraw that. So that's a withdrawn one. And then number 5 is looking at just management. So unlike acupuncture, massage doesn't have a good review article, at least not from this basic search. So what that says to me is really what we need to look at are the individual clinical trials. We can't look at, is there a systematic review or a Cochrane review or a meta-analysis of the literature on massage for knee osteoarthritis, because there really isn't one. So let's unclick review and instead click on clinical trial. So what we just did was we looked for a review article, because those are really the best way to understand what is kind of more of a global sense of this topic. What does the literature say? Give me an overview or a review of what's out there. There wasn't a good one that was specifically on massage. So now we have 11 articles that are specific, hopefully, to massage and knee osteoarthritis within the past 5 years. One thing I do want to point out is after some of them, you will see free PMC article. There's other free articles. So if you click on the left-hand side, it says free full text. This will bring our limits or our number of articles down even further. If you click on that, now we have 4. So again, like Dr. Anderson said, sometimes if you're in clinical practice and it's hard for you to get articles because you don't have access to a medical library, because you're not near a university, or for whatever reason, you can always click on the free full text. It doesn't mean you're necessarily getting the best articles, but you're getting free articles, and sometimes that's a really good place to start. Sometimes the free articles, any articles, will reference other articles that are out there in the literature. If there's other ones that you continually see referenced, even if you have to pay for it or somehow find a library that you can access that article, it might be worth it. But sometimes it's good to start with the free full text. So we now have it narrowed down to 4 different articles. The first one, as Dr. Anderson talked about before, this is actually a comparative effectiveness trial. So it's not looking at sham massage versus massage. It's looking at massage versus another type of health care, which is Ayurvedic treatment and standard care. And so with this one, it's comparing 2 different things. If we move down to the next one, now we're looking at development of a manualized protocol. So development, usually these articles are articles that are published before the study is done. So they're called protocol papers. And these articles will talk about here's what we're doing or here's what we will be doing so that everyone knows, gee, this trial is happening and we're going to be getting results out sometime soon, but it's not the actual results. The third one looks at massage therapy for osteoarthritis of the knee, a randomized dose-finding trial. If we click on that one, so dose finding, we can do dose finding. It's similar to when they do dose finding studies in prescription medications. Usually when a new drug comes out, they have to decide, well, what is the appropriate dose for people to take for it to be effective? In this article, they're looking at, okay, for knee osteoarthritis, how much care do people actually need in order for them to feel the effects? So that's kind of it's an interesting twist that some of the CAM therapies are starting to do, is looking at, well, how much care do people actually need? So in this study, if we look at the methods, it is a clinical trial, an RCT, randomized clinical trial, and they were looking at 8-week treatments, and they were comparing 5 different groups. There's 4 different massage groups compared to usual care as their control. And so again, with this article, it's a free full text, so we can click into it in the upper right-hand corner, and it will launch us right into the actual article where we can read it. That's the beauty of free full text. So again, we can get to this from the limits on the left-hand side within PubMed. And so when we look at this article, again, it's nice to look at where are the authors from. And in this article, we see that Adam Perlman is from Duke. And then if you look right below the names, you can see the numbers that are associated with the author's names. We see that there's someone from Yale and somebody from Boston Medical Center, University of Medicine and Dentistry of New Jersey. So we have some big name schools that this article, that the authors from this article represent. One thing I'd like to do is if you can scroll down to the tables. When I read an article, just like Dr. Anderson showed. She likes to go to systematic reviews, the overview table. I like this first one that you were just on. If you scroll back up just a little. This gives us an idea of what happened in this study. So people were randomized, and then they went to 5 different groups, and they tell us how many people were in each of these groups. There were 25, and that they moved through 8 weeks, 16 weeks, 24 weeks. If we scroll down further, there's actually a dose-response curve.
There we go.
It hasn't come up on my, here we go. And so this is the final results of this article. So it's showing us over the total minutes over 8 weeks that every time they increased the dose, it actually improved the WOMAC scores, which are, it's an arthritis outcome questionnaire that people fill out. And so people got better and better and better the more treatment they got until they got to 480 minutes over the 8 weeks. And so what they're showing us is at that point, it kind of peaks out. People don't get better. If they get more treatment than that, that's really the top end of really the maximum amount of treatment that people actually need. So I really like that we can jump into the article right from PubMed, get an idea just looking at the tables as to what happened. If you can jump back to PubMed.
Yep.
And again, I want to point out that when you're in a document like this, an abstract, oops.
Oops, sorry. Did you want to go back? Sorry.
Go back
into
into
the abstract. And I will mention that we're going to go ahead and on the Journal Club article, the next webinar in the series on the Journal Club, December 2nd, we're going to go ahead and fully evaluate this article as well.
Everyone should be able to access it now. We should be able to find this. Yeah, that's great. The thing I want to point out again in this one is the related citations. If you find an article that seems to fit perfectly for what you're looking for and you want more articles like that, you can always click on the related citation. At the bottom of this list of 5 different articles, you can see other reviews, or you can see all, or you can click on any individual article that they have there. So PubMed is just a wonderful website for people to get used to moving around in. It's a lot like Google. We may not even remember when we first started using Google, but we might feel like we're getting lost and we don't know where we are. If you ever get lost, you can just click on pubmed.gov in the upper left-hand corner, and it takes you right back to the beginning. Notice that those filters or the limits, they're always going to stay activated unless you clear them. And so you might want to just always leave them on, but you might also want to clear them. So again, we search very similarly. When we compare massage and acupuncture, we found very different results. Acupuncture had much more review articles, whereas massage therapy had did not have review articles. We had clinical trials. That's the level of evidence that we were at. So there you go.
Well, great. Well, thank you both for helping us get through that search process. I want to do a quick summary of some of the things that we've covered today and then take some questions. Hopefully, you've come up with a couple of great search tips there on our PubMed search. We've also learned a little bit about the 3 components of evidence-informed practice and how that melds into a clinical jazz that you can, basically your clinical practice. We've also learned about the PICO approach as one way to take a look at refining your clinical search. And I really hope, especially coming from our ACAC perspective on interprofessional education, that really the takeaway is that at the heart of the evidence-informed practice process, you'll note that really this is not one profession specific, that this really applies to all professions across the board. So hopefully that'll be your takeaway today. I do want to go ahead and let you know about our journal article, or our Journal Club Fundamentals that's coming up December 2nd, our next webinar in the series. We'll take a closer look at that particular article that we just pulled up from the massage community and really pick it apart piece by piece and hopefully answer some of your questions. And then we have another teaching research literacy webinar coming up in January. So thank you all again for joining us. Thank you, Dr. Cameron and Dr. Anderson, for all of your help. And my colleague Jennifer's on the line, and she's going to go ahead and feed us any questions. If you have questions, please go ahead and type them into your box at the bottom right-hand corner of your screen, and we'll try to get as many as possible here. So Jennifer, do we have a couple questions?
Hi, everyone. Yes, Deb, the first question from our audience, how could you differentiate the placebo effect from evidence-informed practice, or vice versa?
Dr. Cameron, Dr. Anderson, either of you want to take that question?
Sorry, could you repeat that?
Sure. The question is, how could you differentiate the placebo effect from evidence-informed practice, or vice versa?
I'm just wondering on the interpretation, but I guess we don't have an opportunity to sort of clarify that question, right? You mean that how would we bring in our knowledge of what we think is going on with the placebo with regard to evidence-based medicine? Is that what we think that question means, or?
There might be a misunderstanding as to how placebo actually fits into evidence-informed practice. And really, the placebo effect, we'll have control groups that are placebos because we want to compare the active treatment with a placebo in order to see how much better does somebody get with the active treatment. And that helps us with evidence-informed practice because then we're able to say that this is more effective than no treatment or placebo treatment. And so the placebo really is just a different way of studying. It's a different way of looking at, are people getting better or not. When we have a placebo in a trial, it shows us that people might be getting better, but it's not from what we think is the active treatment. And so I don't know if Dr. Anderson wants to talk about what is placebo acupuncture and how does it different from real acupuncture or not, but there's lots of different ways to look at placebos.
Well, I think the important point to emphasize here is that if you include a placebo control in an acupuncture trial, you're really trying to ask the question, do the actual needles have a therapeutic beneficial effect? And that, of course, is not really an appropriate question for most Chinese medicine practitioners because we don't only use needles. We use a lot of other adjunctive therapies like moxa and cupping and bleeding and tweener and heat lamps and gua sha, etc. But also there's the patient-practitioner relationship. There's the amount of time that the patient spends relaxing on the table. So it's a very complex interaction. And that's one of the reasons why placebo acupuncture is effective, is because these other components are still part of that treatment. So they're still interacting with the practitioner, they're still getting the relaxation component. But even if the trial has excluded other adjunctive therapies like moxa and cupping and that sort of thing. So what we're really interested in is effectiveness, which is a much more simple question that says when a patient goes and sees an acupuncturist in their clinic, in other words, in the setting of a normal clinic as opposed to a artificially constructed clinical trial, does the patient come out feeling better after X number of treatments, which would be, a number that was thought by a qualified acupuncturist to be appropriate for that condition. So, for example, for knee pain, it could be 12 treatments over 6 weeks. So the question is, when a patient goes and has that intervention, 12 treatments over 6 weeks in a normal acupuncture clinic, do they feel better? And you wouldn't include a placebo there because you're not really specifically interested in the needles, you're interested in the whole, everything that goes into that patient experience. As compared to in a randomized control trial that had a placebo control, the question is, when a patient receives that dose, could be the same, 12 treatments over 6 weeks, but with all other factors held controlled, no other interventions, do they receive benefit? In other words, is it really the acupuncture needles? So I think after many unsuccessful attempts at doing those trials, researchers realize, that's not an appropriate question. What we really want to know is effectiveness, and that's why we don't include placebo controls anymore, or for the most part. It's it's a model that's been outdated now.
Great. Well, thank you, Jennifer. Do we have another question?
We have a few more questions. Do doctors Anderson and Cameron have opinions of using UpToDate instead of or in addition to using PubMed?
I like UpToDate very much, but you have to pay for it, and so that's a detriment to many people out there who don't have the finances. They might be just starting up a new practice or whatever. So PubMed is free, and that's what I usually make sure people know how to use.
The other aspect is that's what your patients will be using. So, and of course, you always want to, know how to answer patient questions based on the articles that they themselves might have found in the literature.
Right.
The other thing I also think is important to point out, some people might be thinking, oh, well, the free ones, are they, not as good as the ones that you have to pay for? Well, the interesting answer to that question is that actually the free ones might even be better. And there's kind of two reasons for that. The first one is that any research group that's funded by a government funding agency like the National Institute of Health has to make their publications freely available to the public. So part of those are people that have actually been successful enough to get that federal government funding. And given that the success rate for that funding is now about 8%, you can see that you're really selecting out for the higher quality researchers. And secondly, journals that make their articles freely available to the public are ones where the researchers have to actually pay to get their article published. And it's not inexpensive. It's about $2,000 to get an article published in what we call a free access journal. And once again, only researchers that have sources of funding are able to pay that much to get their articles published. So once again, you're kind of selecting out for the better quality research. So if anything, the freely available publications are the better quality ones. So that's good for clinicians whose only access to the information is through those free articles.
Great. Well, thank you both for your feedback. Jennifer, do we have one more question before we close out?
Yes. This pertained to an earlier discussion. Would articles and studies be inconclusive due to the variety of approaches and points used that do not take into consideration individual treatments?
Yeah, it's a great question. So part of the limitations of what I was talking about before, the clinical trials that look at efficacy, is that they have had standardized acupuncture interventions, which means that every patient gets the same acupuncture points needled during the acupuncture session. And there is, for the most part, no Chinese medicine diagnosis. So I didn't talk about this earlier, but this is another reason why it's been very difficult to demonstrate a difference between real acupuncture and placebo. The reason I talked about is because the placebo intervention is therapeutically beneficial. In other words, people that got the placebo got better. The other reason is that the acupuncture intervention in those efficacy trials is kind of suboptimal compared to what a patient might experience at a regular acupuncture clinic for two reasons. Firstly, there's no Chinese medicine diagnosis, so there's no individualized treatment, and secondly, because all of the subjects in the clinical trial receive the same treatment. So that definitely is, a downside to efficacy trials, and another reason why it's kind of an outdated experimental model. Whereas in these effectiveness trials, like comparative effectiveness that we talked about, the subjects, the participants in the clinical trial, go to see acupuncturists in their normal clinical setting, and they get the treatment that the acupuncturist thinks is appropriate for that individual patient based on their Chinese medicine diagnosis. So once we see more of those trials in the literature, I think the scientific literature will much more accurately reflect what clinicians experience every day in their own clinics.
Ditto for massage therapy and chiropractic. If we think about the patients and the clients that we treat, we don't treat them exactly the same as one another. There's always differences in the way that we treat just based on the way that the patient presents. And so we have to take that into consideration, and not all clinical trials do take that into consideration. That does affect the results.
Wonderful. Well, that was a great question to end our session on. So with that, I want to thank everyone for attending today. I want to thank both of our speakers, Dr. Anderson and Dr. Cameron, for helping us out today and for your participation. So thanks to everyone, and we'll look forward to seeing you all on December 2nd. Have a great day. Thanks.